Good morning. I want to thank all of the legislatures, their representatives, the LIFT Board, the LIFT Legislative Action Committee members, parents, and guests who are with us today. I was given the distinct honor of delivering the first annual report of LIFT's Legislative Action Committee, also known as LIFT-LAC. This committee was created to organize parents and ensure that any challenges or concerns they have about their children's health care are elevated so that decision makers are aware of them. Our LIFT-LAC mission statement reads, we come together to address multiple fractures in the children's mental health system across all public service agencies by exposing the practices that are no longer effective and by advocating for the necessary changes to policies and legislation in order to improve outcomes for Long Island's youth and young adults. This year, our committee significantly contributed to 8 articles and news reports that appeared in publications ranging from ProPublica, Newsday, News 12, and the Albany Times-Union. We brought awareness to the lack of home-based services and providers available to patients, Medicaid patients not receiving services to which they were entitled, ERs not stabilizing patients before discharge, the misuse of restraints, unsafe conditions in a local hospital, advocating for an end to perpetual wait lists for services, raising awareness to long wait times for hospital beds, the closure of RTFs and lack of beds in higher level of care facilities, the lack of supports in schools for children with severe mental illness, and the lack of parity of care for mental health along the entire systems of care. Our experiences were actually raised to the national limelight in a series of ProPublica articles written by Begel. One of these articles was quoted by the Attorney General, Letitia James, when she announced her hearing on mental health in June. LIFT-LAC worked hard to encourage our families and advocates to contribute written testimony to this hearing. Of those individuals willing to make their comments public, there were 12 from Long Island. Additionally, one of those parents was chosen to submit oral testimony at Attorney General James's public hearing. LIFT-LAC and LIFT Executive Director Andrea Stoltz aided parents in creating, editing, and submitting their testimony, provided encouragement, emotional support, reassurance, and advice about maintaining anonymity and ethically communicating about their family members. Through these actions, LIFT acted as a reassurance that an active agency was behind individuals, parents, and families who speak out and who otherwise might be concerned about retaliation. In addition to all of the above, our members were also key presenters at Families Together Town Hall, Families Together Rallies for Mental Health, Families Together Youth Power Weekend, and Healthy Kids, Healthy Minds Speak Out Rally on Mental Health. Additionally, the Healthy Kids, Healthy Minds Consortium has said LIFT's Legislation Action Committee is a model that other regions in New York State should consider when working to organize family voice for its statewide council. Last, but certainly not least, this year we have met with several legislators in person. For those of you who cleared your schedule at our request and gave us the face-to-face time, thank you. We learned a lot and appreciate your perspective. For those of you we have not yet met, we look forward to developing a relationship with you and hope to be in contact with you this year. In closing, I'd like to say this is only the beginning. We want to expand our committee to include members from as many districts on Long Island as we can, so that we can respond to calls of action and continue to provide testimony, interact with the media, and together with legislators, policymakers, youth peer advocates, and parents, effectively plan and execute solutions to today's problems in the system. The LIFT-LAC will also continue to work with Healthy Minds, Healthy Kids, which is a consortium of mental health advocacy agencies across New York State who have combined forces to organize children, young adults, and families with mental health disabilities into a coordinated band of advocates and voters who will work together to ensure that children's mental health is at the forefront of the minds of policy and government officials, and that the family and youth voice is elevated so that the holes and deficits are identified and meaningful change in the system of care across New York are enacted. Always, I ask that our representatives remember healthcare, including quality mental health care for all, is both a human right and an achievable goal. We implore you to use your legislative power to work with us to improve the health of children, young adults, and the families of New York. Thank you.